said in the last hour that I thought Tony Fauci sort of fire hosed everybody watching with unfiltered and uninterrupted facts and truth. And they were still very frightening in terms of what could happen if we stop the mitigation efforts, stop social distancing, stop wearing masks, stop doing any of the things that feel like there's still a push and pull when the president talks.
Yeah, I mean, it is clear about what he's saying because it's entirely based on science and evidence. Nothing about this virus has changed. We don't have a cure. We don't have a vaccine. What's keeping the virus in check is social distancing. And what Dr. Fauci said today is that if we let up on social distancing, then we are going to see an uptick in the number of cases. Now, ideally, the time that the shelter in place, the lockdowns have bought us is the time to build up our public health infrastructure, the testing, the tracing, the other infrastructure that we need to control the new cases that will arise. But the problem is we've squandered that time. We don't have those capabilities in place. And so the consequences are predictable. I think he said it as diplomatically as he could have. But to his point, we are going to see this needless suffering, needless deaths, because we are opening too soon. And as a result, we're going to see the consequences.
You know, Claire, there was something sad for me listening to Dr. Fauci, because I listened to him feeling like maybe he'd made those arguments privately in the Situation Room or wherever the coronavirus task force meets, and he hadn't prevailed. And that after making those arguments in the sit room behind closed scenes and seeing Donald Trump tweet, liberate Virginia, negotiate with the protesters, all he has left is to do what he's done his whole career, which is to tell the truth before Congress. What did you think watching today?
Well, I mean, you can tell this is a guy that is so steeped in science and data that he is going to really keep his blinders on and stay on the science and data. I thought when Rand Paul tried to take a swipe at him, I thought he handled it really well. He said, listen, I know I'm not the end all. But my thing is public health. My thing is science. My thing is data. And I'm going to be offering that information to the people who have the power to make the decisions. Every time he is allowed to talk, especially when the president is not popping up over his shoulder every 10 minutes, to sometimes directly contradict what he's saying, he does a masterful job. And that's why the American people trust him. And frankly, why they don't trust Trump when it comes to all this information.
You raised this exchange with Rand Paul. Let me play it and we'll all talk about it.
I think we ought to have a little bit of humility in our belief that we know what's best for the economy. And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision.
You use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly. But I am very careful and hopefully humble in knowing that I don't know everything about this disease. And that's why I'm very reserved in making broad predictions.
Two men use the word humble. Only one exhibits humility. Claire McCaskill, that was the exchange you pointed out, stood out for me too.
Yeah, and children came up over and over again. And kudos to Senator Cassidy, because Cassidy, he brought up the problem that is now surfacing about these symptoms in children. But one of the things that came out today that was startling was there doesn't seem to be a clear answer about whether or not the children are going to be included in the safety phase of the vaccine testing. They're not going to be able to administer this vaccine to children if the safety of the vaccine hasn't been tested on children. And the fact that the FDA commissioner couldn't answer that question, I was stunned by that. And the other thing, Nicole, that was just an indictment of the CDC was their inability to say when they were going to post the guidelines on testing for reopening the economy. What are they doing?
Right.
I mean, what could be more important? These states are opening, these localities are opening as we speak with absolutely no guidance. And all the head of the CDC said, well, you know, have your state call me. Well, what is up with that? That's just bizarre.
I want to come back to Dr. Wen on the kids. We're all parents here, but Jonathan Lemire, can you take a stab at what is going on at the CDC? They had a model that was shelved by the White House. It made its way into news reports. Your news organization has a pretty stunning body of reporting about the CDC's role in all of this, but there's a constant theme. Disagreements and clashes with this White House are simply shelving the data when it makes its way to 1600 Pennsylvania Avenue.
That's right, Nicole. And my colleagues at the AP have done terrific work unearthing these documents from the CDC, those that were, in fact, transmitted to the West Wing, to the very upper reaches of the Trump administration. Jared Kushner and Chief of Staff Mark Meadows among those who saw them, and yet have not been put into practice, were indeed shelved. And that was one of the many questions that came out of this briefing today. But you're right. I felt like Dr. Fauci, in a way, like just poured a lot of cold water on what the president has been trying to push in the last few weeks, in particular, with this push, this urging for the states to reopen their economies. He didn't do it politically. He didn't attack the president. He certainly never said the words the president were wrong. But he broke with him on a number of things. He did, as you say, point out the timetable for a vaccine could be much slower than President Trump wants. He sort of suggested that this September may be far too soon for schools and particularly universities to reopen because it wouldn't be possible to do the necessary safe social distancing. And he also talked about the death count, which we know is now over, the official tally is over 81,000 or more. And Dr. Fauci said he believed it was actually significantly higher than that, which stands in stark contrast with the president, who publicly has questioned it some, but privately a lot, has suggested that he believes that it's overinflated, that it's being made to look out worse than it is by his political enemies, when Dr. Fauci said the exact opposite. He said that, in fact, it's probably far more Americans have lost their lives to this terrible disease than the president wants to admit.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.